Training worldwide clinical staff on complicated protocols virtually, with the added issue of language barriers, can seem daunting. Our panel of innovative virtual communication experts will show you how to perfect your virtual skills and enhance your virtual meetings. With me today are Marcus Kruer, the head of clinical project management at MERS Therapeutics, Marina Zine, the global medical affairs director in neuroscience at Novartis, Nico Wegener, a senior clinical project manager in global clinical operations at MERS Aesthetics, Dave Matthews, a clinical project director at MERS Aesthetics, Sabrina Kryenzin, a clinical project manager in global clinical operations at MERS Aesthetics, and I'm your moderator, Steve Sulkin. I'm the founder and CEO of SimuLyve International. So I want to ask the panel, and we'll start with you, Marina. How have your personal feelings about virtual changed since the pandemic? Think about pre-pandemic and now in the pandemic. Have your feelings about virtual changed at all?
So since about a year ago, when we were trying to have more agile and more fluid conversations around the world, working in a global organization, the virtual aspect has always been there. But as of a year ago, it became the primary form and in some cases the only form to do business. And it wasn't until about a month or a month and a half in that I started to realize how critical and how vital the video conference was to the day-to-day work, but also for my human and social contact.
I think we've all seen virtual evolve. I mean, even though I've been involved in virtual for decades, it's like we moved forward 20 years in 6 months. I mean, have you seen the same evolution, what you do with us, what you do with the world with virtual?
Yeah, exactly. Everything from the day-to-day menial connections that you might have now is going virtual. But then even on a wider scale, we are having 100 people wide meetings via screens and microphones and in some cases green screens that, again, I think that you probably have a much better idea being in the industry of the logistics that go behind it. But I can definitely appreciate that there's been massive amounts of evolution forward into how we prepare and create and produce these virtual environments.
Marcus, do you have advice you'd give to someone trying to institute a virtual strategy across their entire company?
I think for everyone who is still arguing I would like to go back and I'm looking forward to post-pandemic. Yes, we are all looking forward towards post-pandemic, but I think no one should take this as an excuse not to dive into the virtual settings, because that is definitely something that will remain for sure for each and everyone. So every hour and every attempt and every effort you put into this to try to become better and familiarize yourself with these technologies, I think it's very well invested time.
So it's interesting. It's a perfect segue. The next thing I want to talk about is that, when I introduce the virtual technologies that that we use, you're very used to this now, how we do this. But sometimes people say, well, how is this going to work? And I'll say, look, this isn't so odd. There's a model for it. Just when we're finished speaking tonight, sit down on your couch, click on your TV, and there it is. That's the model. So the model to me this isn't something mysterious. The model is television. Do you see this as a direct model for what we do in the virtual world for communication?
Yeah, except what I feel like, to use a phrase, it's now we're seeing behind the curtain, right? It used to be that we just listened, and I'm thinking Wizard of Oz because this for me was I think that's a classic example, right? Like look at the show, look at the dynamics, and don't look at the man behind the curtain. Now all of us are behind the curtain in some sense, and so it's a revelation. It really truly is, both figuratively and literally.
Right, and actually it makes my job easier because so often, just 9-10 months ago, I'd have to spend a lot more time explaining everything from what a camera is going to look like, what lights are going to look like when they come to your house, what a green screen is, how that works. You don't wear green. Now everybody goes, oh, of course I know that. Everybody's an expert. And matter of fact, this pulling back the curtain again. There's another analog to the pharmaceutical industry. Do you notice because of the development of COVID-19 vaccine, suddenly everyone, my aunt, my uncle, they all say, well, I noticed the study was, against placebo, and they're starting to talk about it against placebo, and they're sort of talking to me about whether the study was done properly, about the protocol for the study, and they now know studies. The curtain of pharmaceuticals, just like the curtain of virtual, has both been pulled back, and I see that as a great thing. It's education, right?
Yeah, you're right. For all those who were not probably directly saying, yes, Steve, you're right, these are probably those that think, well, I'm not able to make TV. I'm not able to produce TV. I'm working in a pharmaceutical company, and my job is not to make TV. This is a job of other persons. And what you recognize, and then I think over there it's a fair comparison, the ways you have in producing, let's say, videos to train anyone on anything, even if it is very, very complex and complicated. That, of course, is very well possible with TV. Well,
yeah, and the reality is you are right. Companies seek the consultation of outside people all the time. So to me, it's no different here. You have to bring in experts. And I think the shift that's changed is before when you run a meeting, you'd want an expert who knows, travel and hotel, right? But now you need an expert that knows television, right?
You're right. And I mean, probably also the acceptance to pay people for that who know how to do it. That acceptance probably evolved and increased during COVID-19. Before that, you always thought, well, why should I spend so much money in this? Well, it's better if we fly there and if we have that face-to-face meeting. Now this face-to-face meeting is not possible any longer. All those costs you would have spent in I don't know how many flights and hotels and whatever, you can now invest in the right technology to produce really good and meaningful media and movies or training videos.
Yeah. Well, again, necessity is the mother of invention. We don't know how clever we are until we're forced to be more clever.
Yeah, maybe it is, yes.
Yeah. So let's talk about pre-recording here for a minute. I'm a big proponent of it, and again, for people who aren't used to it, sometimes they think, pre-recording means that it's not interactive. No, that's not how it works. They misunderstand. We pre-record, right? And then we take the recording, we edit, we make it perfect, and then we stream it live to a virtual audience. We click a button and the audience interacts. Nico, what was going on in your mind individually and as a corporation that said, I think that's the route we want to go. We want to pre-record, and then we want to stream those pre-recordings live to a virtual audience and then have interaction. What caused you to go that route?
I think in the beginning, it was the idea because it was simply very, very similar to a live meeting. So you talk to the audience about your content, and then simply you get your questions. So if we do the pre-recording, we stream it to the audience, and we get the questions right back. That's basically the same.
And from our perspective, coming from the world of television and broadcast, the thing that most challenges people in my business, broadcast business, is live television, right? So in the television world, we try to pre-record as much as possible. Like even when you watch BBC News, a lot of that, it seems live to you, but actually a lot of it is pre-recorded. And then they stream it to you, and then every once in a while, they'll have a conversation with somebody live. But of an hour BBC television show, it might be 90% pre-recorded. Marcus, what are your thoughts on this?
Well, compared to television, we don't want to entertain and we don't want to be funny, but we need to transport sometimes tiny details, and these are the relevant details, and that is important for the sake of that study. So if you do it just live and hope you don't forget anything, hope is good, but if you can control it, and with this technology you are able to control it, then you pre-record. So if I have the chance to minimize the chance or the risk and mitigate the risk that those relevant details are missed, then I will do so, and this means for me pre-recording is necessary.
That is so eloquent, Marcus. I want to tell you, if there's nothing else that the audience who watches this panel discussion learns, it could be just that. and they would know everything, because you're 100% correct. And it's interesting also, you pointed out that this isn't entertainment. This is medical education. And that's why sometimes when I make the analog to television, people can understandably misunderstand. They can think that I'm saying that it should be, entertaining and funny. No, I'm not talking about it being television-like in terms of its content. I'm talking about it being television-like in terms of its infrastructure, right? So to me, what you've done, and a lot of very good companies, is you've taken the infrastructure of the broadcast media world and combined it with the needs of medical education. And to me, that's where the sweet spot is. So I'm going to flip this. We've been talking so far the whole time about all the positives in the virtual world. Dave, tell me a little bit about the mistakes presenters make that you've seen when presenting virtually.
Oh, sure. So lack of preparation. I think you have to prepare for a virtual meeting just as much as you would if it was a live meeting. Presenting virtually live, just like I did, there's a lot of ums. So, and I may not realize I've made a mistake, but the viewer on the other side may clearly know that I made a mistake and it's something I said.
Yeah. So it's interesting. You said that you have to prepare, and you compared it to a face-to-face meeting. Do you think people tend to prepare a little less for virtual meeting for some reason that would be unknown to me?
Oh, certainly. We realized pretty quickly that we needed to be just as prepared for a virtual meeting, if not more so, than for a face-to-face meeting. And there's a lot of pressure on you when you're sitting behind a camera. Everybody's looking at you, whether you realize it or not. They're all out there looking at you.
Yeah, I've heard people sometimes say, when I'm on stage, I'm a better presenter. And I sometimes push back and I said, you might think you're a better presenter, but I bet you if I recorded you and you watched yourself, you do what we all do, what I do when I watch myself. I watch myself when I present, and I've recognized that how I thought I was coming across was very different than how I actually was coming across. And just like when you're in sports, you might watch, if you're on a football team or whatever, you're going to watch your last game to see how you did. Same thing with this. I watched myself on film and then I recognized, that sense that I did a great presentation at the last face-to-face meeting was false. Mm-hmm. The more I record myself, the more I can really analyze and then improve. Have you experienced this?
Yeah, and so my earlier answers about virtual is I was just thinking virtual live, but when you're doing pre-recordings, yes, you can completely make a presentation a lot better. You can splice together two or three or even 20 different takes of the same slide and put the best parts of it all in one seamless presentation that ends up, nobody would ever know that I did that 20 times.
Yeah, the editors are quite miracle workers, aren't they? When you see the raw film and then compare that to the edited film, it's amazing, isn't it?
Yeah.
So let's move to a subject matter that you've had a lot of experience with, and that is conducting meetings in China and translation. Okay? Yes. Tell me about your experience. We've done a lot of this together. Tell me about your experience in this regard.
It's very helpful because the audience feels much closer to our study. So no one has to be afraid not to understand a detail, which is very important for the study maybe. They can all listen to it in their natural language. You need to find people who know the medical vocabulary we are using every day. And this has to be translated very accurately. And especially in our Chinese translations, we have discovered that there are really subtle differences when you talk about subcutaneous or subdermal, for example. That makes a big difference already, and you need to find the right translation here.
It's apparent to me you recognize what a difficult thing this is, but yet how amazing it is when it works well, right?
Yeah, absolutely. It's amazing that you can talk to a Chinese-speaking person basically in real time. It's again on us as a presenter to get used to this simultaneous translation. You need to cut your brain in half, basically, to have one ear on the English side and the other one on the Chinese side. But it's really very helpful, and it gives also a confidence to our audience to ask questions.
Right, exactly, yeah. So Let's talk, and I think this part of our last subject matter is that a lot of people say, oh, I want my meeting to be more engaging. And I've heard all kinds of things. Well, let's play games first. Why don't we have everybody on Facebook? Why don't we use Twitter more? I mean, and they have all these, or why don't we have a platform where all avatars and we can walk around? And I say, guys, yeah, all that's fun. That's fine. But I say, you know how to make something engaging? Actually make it engaging. In other words, have good content. You know, the expression in the film, television world is content is king. Focus on good presentations, good content with flawless, infrastructure. What is your thought about this?
Yeah, agree. Good content, credibility. Of course, we would all like to have that kind of engaging, fun interactions. There are some means of having kind of fun interactions. There are things like quizzes and so on to really increase the kind of Q&A and the interaction. But as said, credibility, content, what do you want to present? And this is what finally counts.
Absolutely, content is king, but also the presenter needs to be king at least for a certain amount of time, because he needs to be convincing and he needs to be comfortable. And that's what we discussed initially. So people need to get trained on that. People need to collect this experience. But I think it's a fast process. It's not that difficult in the end.
I would say think about with your team or with yourself what you would like to present. What I do not like especially are slides which are full of text, and what is the focus of the message, what is presented, and not always to read the whole text from a slide, from time to time, and to repeat it all the time. Sometimes it makes sense to show nothing, because then everybody can think about. So the content is important. That's true.
Yeah, and it's simple fixes and simple things. Engaging doesn't mean reading, in a monotone voice. So not only the inflections and the tones and the dynamic with you speak, but also the way you pause and the way that you look at people. All of a sudden, there's a difference, and our brains are so astute to picking up those changes that you're automatically more in tune if somebody is an engaging speaker, if somebody is speaking with you, not at you.
Yeah, I've had people say they want the meeting more engaging, and they actually didn't even turn their camera on. And I know we're almost out of time, but I want to give a real quick anecdote. When I give keynotes occasionally, and when I try to make the point of how important a camera is, it's amazing to me. I have to educate that the camera is important. But what I do is I start my speech at this face-to-face meeting, and I have my PowerPoint slide up on a big screen. There's like 2,000 people in the audience, but I'm backstage and I have a microphone. And I start giving my presentation. I say, hi, this is Steve Zalkin. I'm here from SimuLyve International. I'm going through it, and people are like, what the heck's going on? They don't know where I am. And I said, this is weird, isn't it? You don't see me, but you're hearing me. This is the problem in virtual when you don't even put your camera on.
Yeah, absolutely. I mean, it's much better now also to talk to a person in a camera than just to look at my slides. And just now when we're talking, I'm already developing new ideas how we could take it from here and how I can implement those learnings, or what I'm learning right now when I'm sitting here, in maybe some future virtual investigator meeting. So why we are even looking at a slide deck, why we cannot design it as a kind of interview that you think about someone asking you certain questions for the protocol. I mean, I think that's the next step we have to do, and we need to let go of presentations.
I completely agree with you. We need to recognize that just a didactic presentation is not the only way to educate people.
I think we have even more chances here, because we can also collect the questions from the audience before we even do our videos. And we have done it already now to be aware what are the questions here. But if we are doing it in a kind of interactive way, you have a much better way to deal with those questions and to answer them much more naturally and clearly to the audience, I think.
And the way we can do that is we can have sort of pre-materials videotaped to put up and say, okay, we want you to watch all this, or maybe even just this one sort of general video. I'm actually creating as we're talking right now. Maybe there's this one general video about the study, about the protocol. We want you to watch that just to inspire you to ask questions about this study. And then send in all your questions, and then we'll incorporate those questions into our presentations and our, as you put it, the talk show type of presentation as well. I think it's a fabulous idea.
Well, let's see where we get from here, right? I mean, just as a starting point for us, and with all our experience now, I think we're on a good way.
I'd like to thank our panel for all of their expertise. It's been a fascinating discussion. Stay safe and stay healthy.